Kenji back again, and this is module 4. In this module we will be looking at sectional anatomy of the neck. Head and neck is a term used collectively to describe the extracranial structures, including the sinonasal cavity, skull base, pharynx, oral cavity, larynx, neck, orbit, temporal bone. The head and neck region encompasses a tremendous spectrum of tissue in a compact space, with almost every organ system represented, including the digestive, respiratory, nervous, osseous, vascular systems. Both multi-slice helical CT and MR can provide exquisite imaging of the normal and pathologic anatomy of the head and neck. Although each modality has advantages and disadvantages, the decision is on whether to use CT versus MRI for each individual case is often based on considering which techniques the patients are more likely to tolerate. For example, if a patient has difficulty handling their oral secretions because of prior head and neck surgery, particularly following tracheotomy or partial glossectomy, they may have significant hardship laying still for the time required for MR scanning. In such cases, the rapid imaging time of multi-slice helical CT is more likely to yield a study unmarred by motion artifacts. This is a great illustration of the neck area, and you can see the nasal passages as well as the nasopharynx, oropharynx, and laryngopharynx. The organs include, of course, what we just mentioned: the pharynx, larynx, esophagus, trachea, salivary glands, thyroid gland, and cervical lymph nodes. The nasopharynx is the most superior portion of the pharynx. The oropharynx is the posterior extension of the oral cavity and extends from the soft palate to the level of the hyoid bone. The narrow laryngopharynx continues from the oropharynx and lies between the hyoid bone and the entrance to the larynx and esophagus. It continues as the esophagus at the level of the cricoid cartilage of the larynx. This image here is on page 252, and it gives a posterior view of the pharynx. So you're looking at the pharynx from the posterior aspect. This illustration identifies excellent with great specificity the nasopharynx, the oropharynx, as well as the laryngopharynx. Structures that stand out to us would include the valleculae as well as the piriform sinus. We hear about these two structures, especially during swallowing studies. Okay, all of the anatomy on this image is necessary to know. This image can be found on page 253. The soft palate, the clivus, pharyngeal tonsils, nasopharynx, hard palate are pieces of anatomy that we identified during a discussion of the face. So you want to be very conversant with those. You want to be able to identify readily the pharyngeal tonsils and adenoids if they were inflamed. The valleculae, sorry about that. The valleculae, which flanks the epiglottis. Okay, so you have the epiglottis right here, and this folds down to cover the trachea whenever the swallowing reflex is initiated. And the esophagus is posterior. So if you're looking at it in a cross section, you'll see that the trachea is anterior to the esophagus. Trachea is held open by the cricoid cartilage, so regardless of position, it should remain patent. whereas the esophagus will collapse if you're not utilizing any type of swallowing mechanism. And another thing I want you to pay particular attention to, and you'll see this, I'm going to mark it up right now, but we'll see this on subsequent slides, is the anterior soft tissue. That soft tissue that lays anterior to the spine is very, very thin until we get to the point where the esophagus begins. So the soft tissue, the prevertebral soft tissue, sometimes what it's called, can be 2 to 4 millimeters, where the prevertebral soft tissue of 5 should be between 5 to 10 millimeters thick. If you have prevertebral soft tissue swelling before C5, so we got 2, 3, 4, 5. So if you have prevertebral soft tissue swelling before C5, highly suspect fracture, and that soft tissue swelling is blood. T1X, axial MRI, which identifies some of the muscles of mastication, in which we discussed during the face. I'm trying to orient myself. This is page 254, and readily identify the mandible right there, and then you can readily identify the masseter muscle right there. That's the masseter muscle, and on the inside of the masseter muscle, it's the pterygoid, medial pterygoid muscle right there. So you have the masseter muscle, and you have the ramus of the mandible, and then you have the pterygoid muscle. And we would call this the medial pterygoid muscle because right behind the pterygoid muscle is the pterygoid plate, followed by the pterygoid muscle, more pterygoid muscles. Page 5A, so we're now on page 255. And this is an axial T1 weighted MRI of the oropharynx. We want to, and since we're talking about the neck now, one of the major muscles that we need to understand is the sternocleidomastoid muscle, and its origin point on the mastoid. That's the mastoid portion. So one of its origins is on the mastoid. The other endpoints is on the sternum. It bifurcates at the end to the sternum, and the cleido is for the clavicle. So sternum and clavicle are the other endpoints for the sternocleidomastoid muscle. Very important muscle because it is a division point for certain anatomic structures of the neck. So that's what we want to pay particular attention to right now. When I'm just looking at this page, the hypoglossus muscle, we're going to talk about that. We're going to talk about the submandibular gland. And you know that the submandibular gland is in this region, right there. The sublingual gland is in this region. So this would be submandibular gland right there. Okay. The semispinalis capitis muscle, the splenius capitis muscle, and the trapezius muscle. All of these muscles are important posterior muscles of the neck. Axial T1 weighted MRI of the valleculae. They say the valleculae. So if we know that the epiglottis should be somewhere in this picture, if they are stating that the valleculae is seen, well, here's the valleculae, and there's your epiglottis. Okay. Palatopharyngeus muscle. important muscle for initiation of the swallowing reflex. And again, there's the important sternocleidomastoid muscle right there. So over here we have the sternocleidomastoid muscle right there, and the levator scapulae muscle right there. They marked it over here. Important muscles of the neck. When we talk about the neck, about 50% of the discussion is going to be pertaining to the musculature of the neck. We would talk about the oropharynx, we'll talk about the nasopharynx and compartments, but a very important aspect of the neck is understanding the muscles of the neck. So here you can see a good picture of the submandibular gland, and you can look at the grayscale of the submandibular gland versus muscle. Okay. The salivary glands collectively produce and empty saliva into the oral cavity via ducts to begin the process of digestion. There are three paired salivary glands: the parotid, submandibular, and sublingual. Axial T1 weighted MRI of the laryngopharynx. This image can be found on page 260. No, not 260. 259. This image can be found on page 259. And here we can again notice the sternocleidomastoid. Remember, I said this is a very important muscle. So you always want to pick this one out. If there is a muscle in the neck that you want to know, is the sternocleidomastoid muscle right there. There's the other sternocleidomastoid muscle. It actually separates the anterior and posterior triangles of the neck. And because there are certain anatomical structures that live in the anterior triangle, certain structures that live in the posterior triangle, where the sternocleidomastoid is the border for the anterior and posterior triangles of the neck. Important pieces of anatomy to identify from this slide: thyroid cartilage, the platysma muscle. Right there, you might think it's thin, but it doesn't. It actually wraps the entire bottom portion of the mouth. So if we had the platysma muscle come down like that, and it actually fans out. The platysma muscle fans out like that. So sometimes you can actually play with your platysma muscle when you kind of pull up on the muscle underneath of your jaw, and you feel the skin on the upper portion of your chest pull. You're actually contracting your platysma muscle. Okay, this is an illustration of the larynx. You want to identify what's important here is to identify the cricoid cartilage right there. The cricoid cartilage. You can palpate that. And the epiglottis, illustration of the epiglottis that flips down, and the arytenoids cartilage right there. These are markers that you can readily identify on the neck, whether you're doing MRI or CT, and pretty much examinations of the neck will be using the CT as the modality of choice. But sectional anatomy is going to cover the neck, so therefore we will have to cover the neck extensively. So the larynx is the bony skeleton that surrounds and protects the vocal cords, and is commonly called the voice box. The three paired cartilages are the arytenoids, the corniculate and cuneiform. The largest and most superior is the thyroid cartilage. The cricoid cartilage is a complete ring that forms the base of the larynx on which the other laryngeal cartilages rest. Alright, so remember the cricoid cartilage is a complete ring, whereas the other tracheal cartilage is soft during the posterior portion of the ring. This allows for the esophagus, the peristalsis. Sagittal T1 weighted MRI of the larynx. Here you want to identify the thyroid cartilage. It's pointed out for you, but you want to be readily able to identify the thyroid cartilage and the laryngeal ventricle right there. So if you are wondering where is the larynx, where's the where's the voice box, is the voice box is actually the beginning or the orifice to the larynx. So when the epiglottis folds down, food travels down the esophagus, which is collapsed right there. During the swallow and study, if you see any food or liquid past this threshold, you can call it penetration. And when the food reaches this portion of the larynx, you get a coughing reflex. Without the coughing reflex, you have the food or liquid drip down into the trachea, and then you can call it aspiration. But this image should be on page 261. Yes, page 261. Level of C3, C4, you see again the sternocleidomastoid muscle. Again, anatomy of interest on this page would be the valleculae, epiglottis, mylohyoid muscle, geniohyoid muscles, the base of the tongue muscles. Remember, you got the palatopharyngeus muscle. It's one of your constrictors. Middle constrictor. These are the muscles that peristalse to help food to travel down the esophagus. External carotid, jugular vein, internal carotid, vertebral arteries coming up the transverse foramina of the C-spine. This is the level of C5. You should be able to identify the glottis, and the glottis is actually where the vocal cords are. Okay, so the glottis is this open region. The epiglottis just means around the region, but the glottis is this open region which is flanked by your true vocal cords. Okay, so the thyroid cartilage, you want to know cricoid cartilage, you want to know common carotid, the internal jugular, the constrictor muscles, the true vocal cords, this region called the glottis. I'm sorry, didn't mean to cross that out. Absolutely, the sternocleidomastoid, and sometimes the sternocleidomastoid muscle is abbreviated SCM. Okay, and there's the arytenoid cartilage, what I was trying to discuss. Very important piece of cartilage. And actually I circled both of them, but this is the arytenoid cartilage right there. The cricoid cartilage is the one in the back. Cricoid cartilage, what sits on top, little horns, is the arytenoid cartilage. And again, remember this platysma muscle right there, and it loops all the way around, and it fans out to the upper chest. Axial T1 weighted MRI of the esophagus and trachea, this region of the esophagus and trachea, this would correspond to the level of C7, and you can view the trachea right there, and it's flanked by the thyroid. So the thyroid gland actually surrounds, I guess, the upper 200 degrees of the trachea. Esophagus, which is collapsed in the back, there's no food, there's no need for it to be open. And another group of muscles that's important is the scalene muscle. So you have the anterior, the middle, and the posterior scalene muscles. That's the group. If my outline is not precise, forgive me, I'm doing this with a laptop muscle group. So you should be able to look over here and find the corresponding muscles. But the scalene muscles, the scalene muscle group is important. And you have the anterior. You can break it off here, break it off there. You have the middle, and you have the posterior group. Now we've traveled back up the C-spine here. It's axial T1 weighted MRI of the neck with the parotid glands. Look like at the level of C1, because I'm looking at the odontoid process. So if you're looking at the odontoid process, well, C2 is going to be inferior to this image right there. So it should be in the region of C1. An anatomy of interest would include the hard palate, and soft palate. Very important is the medial pterygoid muscle, which sits just medial to the ramus of the mandible right there. So you have the masseter muscle, and you have the medial pterygoid muscle. We talked about the constrictor muscle, if you remember it, the palatopharyngeus muscle. Okay, the mastoid process of temporal bones. We discussed the odontoid process, the sternocleidomastoid muscle that is originating from the mastoid. Remember that. You have a picture of the internal jugular vein and internal carotid artery and the parotid gland. So this would be all parotid gland. So if this is marked, let's go to the other side. This is all the parotid gland. And right in this region you will have is a duct that you should be familiar with that runs through the parotid gland and secretes saliva. Stenson's duct, if you forgot it. Okay, coronal T1 weighted MRI image of the parotid gland. Excellent view of the parotid gland, even though we dissected the upper portion of the parotid gland. So this whole piece right here would be of the parotid. So we actually cut the upper portion of it. And the same here, we also cut the upper portion of it. Things in the neck that have this bean-like appearance, it's not vascular. You know it's not a vessel on end. We just attribute to lymph nodes. Here's a good coronal image of the sternocleidomastoid muscle. And they have the vertebrals that's flanking the vertebra. So we are actually dissecting the transverse foramina. And here's a good picture of the brachial plexus. So the parotid duct, which is Stenson's duct, emerges from the anterior edge of the gland. As far as the other salivary gland, the submandibular gland borders the posterior half of the mandible. Remember that picture, the posterior half of the mandible is the submandibular gland. The submandibular duct, or Wharton's duct, opens into the oral cavity on either side of the lingual frenulum, immediately posterior to the teeth, frenulum. And numerous sublingual ducts, Rivenous ducts, opening in the line along the floor of the mouth. Okay, coronal T1 weighted MRI of the submandibular ducts. Anatomy to identify here, of course, would be the tongue, suprahyoid muscle, thyroid cartilage, the cricoid cartilage we talked about, the sternocleidomastoid muscle. We want to be familiar with infrahyoid muscle, the hyoid bone, and the infrahyoid muscle just pulls on the hyoid bone and acts on the hyoid bone. And then we also want to be familiar with the submandibular gland, which sits at the posterior aspect of the mandible, and a picture of the masseter muscle. Okay, in this picture we want to identify the region of where the submandibular gland would be and where the sublingual glands would be. So the submandibular, sublingual. This is a sagittal T1 weighted MRI image of the lymph nodes, and you see multiple lymph nodes. All these little dots are lymph nodes, but here you see a good elongated view of the sternocleidomastoid muscle. This is a good illustration of the fascial planes. There are many fascial planes in the head and neck, and fascial planes you can think of as separate compartments. The suprahyoid and infrahyoid regions of the neck can be further divided by layers of fascia called fascial planes that separate the anatomy of each region into compartments or spaces that contain distinct anatomic structures. Knowledge of the anatomy in these compartments improves the ability to predict the spread of pathology throughout the soft tissue structures of the neck. This is an illustration of some of the fascial planes, and the dark lines indicate the compartments. The compartment that I want to bring your attention to is the compartment, this compartment right there. And if I cover it up, you can look on the opposite side. But that is called the carotid sheath. Very important compartment because it houses the carotid artery, it houses the jugular vein, and it houses the vagus nerve. So that's the carotid sheath. I mentioned a little bit of it earlier, but that's the carotid sheath, and it houses, remember, the carotid artery, the jugular vein, and the vagus nerve. So you should be able to identify the carotid sheath in this picture, and you may not be able to identify the vagus nerve, but if you know that the vagus nerve resides in the carotid sheath, then all you need to find is the carotid artery and jugular vein, and you can be certain that the vagus nerve, cranial nerve number 10, is right in the region. And the phrenic nerve is in the compartment right behind it. So you have the phrenic nerve, and you have the phrenic nerve right there. And when you see hemorrhage of the neck, or pneumatosis, some emphysema of the neck from something ruptured, perhaps the trachea, you'll see separate compartments become consumed with air, and other compartments do not, are not consumed with air. And this will give the extent of the trauma of what is perforated to whatever compartment air is visualized in, and whatever compartment air is not visualized in. This is at the level of C7 and shows the trachea with relation to the fascial planes. And the relationship of the trachea and esophagus actually this is a good picture of it. You see the trachea is anterior to the esophagus. And when you discussed, or we discussed earlier, about the prevertebral soft tissue swelling, remember that if you had a broken neck vertebra, blood would escape and occupy some of the prevertebral. It'd go all around, but it occupied a prevertebral soft tissue swelling. So now we have the alar fascia right there. So this fascia would actually compress out, and your esophagus will move out, and so would your trachea. But this soft tissue area in front of the vertebra is what you'll be looking at. And if it's larger it is, the more blood is in there, and the more blood, that means the more traumatic the injury. So if you see a lot of prevertebral soft tissue swelling on a neck trauma patient, is a very serious condition. Keep that in mind. So in this image here, you want to be able to identify the subclavian vein, the anterior scalene muscles. You want to be able to identify the vasculature, subclavian vein, subclavian artery. So remember when the physicians or whoever is putting in the central line, where they're going in the subclavian vein, and that's because it is more superficial. They have the lungs, and it's the lungs right there. And this here's a good picture of the platysma muscle, which fans out into the anterior chest. T1 weighted MRI of the neck with the parotid glands. So this is the masticator space. They outlined it for you. And the masticator space, of course, has the masseter muscle, the ramus of the mandible, and the medial pterygoid muscle. I think we're fully competent on that group of anatomy. Axial T1 weighted MRI of the neck with the oral pharynx. So we want to identify the oral pharynx, and they labeled it for you. So it's the area of the oral pharynx. It's just a space. And you have your vertebra, and you have your transverse processes of the vertebra. And the transverse processes of the cervical vertebra have the vertebral vasculature traveling up. The muscles that you want to know are the sternocleidomastoid muscle, Oh, there's the constrictor muscles, genioglossus muscle, hypoglossus muscle, mylohyoid muscle. These are all muscles of the base of the tongue. Internal jugular vein. So we have the internal jugular vein, but we know where the internal carotid artery, external carotid artery, we know that the vagus nerve is right in this inside of this fascial plane. So you want to identify the pharyngeal mucosal space. They outlined it for you, the pharyngeal mucosal space and the carotid artery and the jugular. So you have internal carotid and they call it internal jugular vein, external carotid, right there. So those are the pieces of anatomy of interest in this particular slide that you want to become familiar with: the pharyngeal mucosal space, internal jugular vein, and internal and external carotid arteries. Axial T1 weighted MRI of the neck with epiglottis. Of course, there is your epiglottis. Along the epiglottis is your valleculae. Okay. Genioglossus muscle. Base of the tongue muscle, of course. Retropharyngeal space, what they're calling here, and we know. Okay. Don't know what that bing was for, but I think we'll continue. The palatopharyngeus muscle. Again, those muscles that peristalse food. Sternocleidomastoid muscle, important on this slide also. Right there. The platysmal muscle. And the submandibular gland, salivary glands, again, posterior aspect of the mandible. Anterior would be the sublingual. Axial T1 weighted MRI of the neck with the hyoid bone. Again, identify the sternocleidomastoid. We're going to follow this long muscle from its insertion to insertion. Mastoid tip to the sternum and clavicle. And also is a picture of the inferior constrictor muscle. So we're a slice lower than where the palatopharyngeus muscle would be. And the largest constrictor is the inferior constrictor muscle. It's innervated by the vagus nerve, and when food is swallowed, the constrictor is what moves the food down the esophagus. So here we want to identify the arytenoid cartilage, as well as the vocal cords. Those are important to identify. And there's the arytenoid cartilage, and then you have the vocal cords. So the paired arytenoid cartilages are shaped like pyramids and are situated at the posterior aspect of the larynx, just on top of the cricoid cartilage. The arytenoid cartilages to the posterior laminal surface of the thyroid cartilage and are separated by a space termed the laryngeal ventricle. The superior pair of ligaments is called the vestibular folds or false vocal cords because they are not directly concerned in the production of sound. The inferior pair is the true vocal cords, named accordingly for their involvement in the production of sound. So here you want to identify the thyroid, trachea, esophagus, as well as the scalene muscles, the anterior, middle, and posterior scalene muscles. The esophagus is a muscular tube that extends down from the laryngopharynx to the cardiac orifice of the stomach. The trachea, considered the airway, extends from the larynx to the lungs and lies immediately anterior to the esophagus. Considered an elastic tube, the trachea is reinforced by approximately 16 to 20 C-shaped pieces of cartilage that maintain an open passageway for air. And remember, the posterior portion of the cartilage is open just to allow for movement of the esophagus. So, it's just another wonder of how the body is made. So the thyroid gland flanks the trachea. Thyroid gland. So this is the thyroid. Flanks the trachea. That's the trachea right there. And the thyroid gland is an endocrine gland located at the level of the cricoid cartilage. It consists of two lobes that are joined together anteriorly by the isthmus. The thyroid gland secretes the hormones thyroxine, triiodothyronine, and calcitonin, which affect almost every cell in the body. These cells help with metabolism. Remember that thyroxine and triiodothyronine stimulate cell metabolism and are essential for normal body. This is an illustration of the pharyngeal area. So the pharyngeal area, nasopharynx coming down, and the tongue. And you can identify those glossal muscles that we spoke about earlier, the genioglossus, styloglossus, and the hyoglossus. All act on the base of the tongue and help for movement of the tongue. So there are three overlapping constrictor muscles, and these are the pharyngeal and tongue muscles. They are the superior, middle, and inferior that are responsible for constricting the pharynx and inducing peristaltic waves during swallowing. The three inner longitudinal muscles include the stylopharyngeus muscle, palatopharyngeus muscle, and the salpingopharyngeus muscle. The extrinsic muscles of the tongue are responsible for changing the position of the tongue and include the genioglossus, hyoglossus, styloglossus, and the palatoglossus muscle. In this image, you want to be able to identify the mandible, the masseter muscle, the pterygoids, the longus capitis and coli muscles, as well as the internal and external carotid. So on this image, we have discussed pretty much all the pieces of anatomy on this image, and you should be pretty conversant with them all. Of course, the ones I didn't discuss yet, the uvula, but we should be aware of the uvula. Sternothyroid muscle. and the muscles that act in or around the thyroid and the hyoid bone. Otherwise, we discuss many pieces of anatomy that's in this picture. And here's the prevertebral soft tissue. And remember the fascial plane, that if there was a fractured vertebra in this level, blood would occupy the fascial plane and would increase this prevertebral soft tissue and move all of the normally seen anatomy forward. Cricoid cartilage, the arytenoid cartilage that sits right on top of the cricoid cartilage. Trachea, collapsed esophagus, that's posterior to the trachea. Foramen magnum, the medulla, spinal cord, medulla, cerebellar tonsils, pons, nasopharynx, pharyngeal tonsils. This is your hard palate. And then where the palatine bone ends, there's a layer of tissue that hangs off of it, and that is called the soft palate. So this hard palate is actually the palatine bone. The maxillary is the most anterior portion. The palatine bone is the posterior section. The piece of soft tissue that hangs off is called the soft palate, and it leads into the uvula. Okay, so we have an illustration, coronal view of the tongue muscles, muscles that we have gone over, but this is a good illustration to show the difference in the structure of the muscles. So we have the styloglossus out there, and you have the hyoglossus, or hyoglossus, however you want to pronounce it. Genioglossus is the most internal. So from inside to out, you have the genioglossus, genioglossus, the hyoglossus, and you have the styloglossus. And this is the platysmal muscle. And the submandibular gland. So the submandibular gland. So we're at near the angles of the ramus of the mandible. T1 weighted coronal image of the tongue muscle. So you want to identify those tongue muscles, stylo, genio, and the hyoglossus muscles. So we need to be familiar with the anterior and posterior triangles. So we want to identify the sternocleidomastoid. Very, very good picture of this muscle, sternocleidomastoid. You see it attaches to the mastoid and travels down, bifurcates, and part of the head goes into the clavicle, the other part of the head goes into the sternum. Good picture of the masseter muscle. And they call this the platysmal muscle, and they call it cut because the platysmal muscle will actually go all the way down. So they call it cut. They cut the platysmal muscle just so that you can see the underlying structures. Okay. Another illustration. Anterior view of the suprahyoid and infrahyoid neck muscles. Identify the hyoid muscle. Identify the hyoid bone and all the muscles that attach to that hyoid bone. Many things act on a hyoid. Hyoid was the only bone that doesn't articulate with anything else. Well, it's just not hanging there. It forms an attachment to many muscles. So the muscles of the posterior triangle include the trapezius, splenius capitis, levator scapulae, and anterior, middle, and posterior scalene muscles. The neck is frequently divided by the sternocleidomastoid muscle into two areas called the anterior and posterior triangle. The platysma is the most superficial muscle found in the anterior portion of the neck. Other muscles of the anterior triangle are referred to as the muscles of the throat and can be divided into the suprahyoid and infrahyoid muscle groups. Trapezius muscle, the deltoid muscle which overlies the shoulder, and the levator scapulae muscle. Levator scapulae, so it lifts the scapula up. You can actually constrict your levator scapulae. And now we can identify the platysma. Now they have an illustration going all the way down. So this is your platysma muscle. All of this is illustrated going all the way down. They didn't cut it this time. So you can even try to move yours. Imagine a fractured zygoma, because you have the zygomaticus muscle. So if you fracture your zygoma and this muscle contracts, it can actually cause a lot of pain to that area, but there's no motion on the lateral aspect of the mouth. I guess you can look at table 5.3. Anterior view of the extracranial vasculature. The right common carotid artery arises from the brachiocephalic artery posterior to the sternoclavicular joint. Located on the external surface at the bifurcation of the common carotid artery is the carotid body, a small neurovascular structure that acts as a chemoreceptor to sense changes in the chemical composition of blood. At its origin, there is a dilatation called the carotid sinus, which contains baroreceptors that react to changes in arterial blood pressure. As the external carotid artery ascends the neck, it passes through the parotid gland to the level of the temporomandibular joint, TMJ, where it bifurcates into its terminal branches to supply blood to the face and neck. This image can be found on page 301. And right here you can see the common carotid arteries come up, and they actually cut out a box for us so that we can clearly identify the carotid sinus as well as the carotid body. Okay, so you can identify the carotid sinus as well as the carotid sinus as well as the carotid body. Alright, so we got the carotid body and the carotid sinus. This is a CT image, anterior oblique 3D CTA of the extracranial arteries, which shows the bifurcation of the common carotid into the internal and external carotid rather well. You even see the left facial artery, and if you actually feel on your mandible in this region right there, you can actually feel a pulse. I'm putting my two fingers on mine as I speak, but yeah, you can feel a pulse, and that pulse is coming from the left facial artery. That pulse is very pronounced because it's blood that's actually coming straight off the common carotid artery. So it should have a very, very strong thrill to it. But you want to identify the bifurcation of the carotid artery, a great spot for aneurysms. All right. And you want to also get the origins of the carotid. So you want to get the aortic arch. if you are interested indeed in the carotid artery. This is a MRI of the extracranial arteries. Very, very busy looking picture. However, if you understand your anatomy, you can cut out portions that you're relatively uninterested in. So if we're interested in the carotids, then we can see the carotid arteries, right? And since we're looking at it in face, we don't see the bifurcation as well. But if you rotate this on a inferior superior axis, you'll be able to see the bifurcation much better than this. And you can also see the vertebral arteries coming off of the subclavians. Subclavian arteries. Very nice shot. In this picture, you want to identify the subclavian, brachiocephalic, external jugular, hyoid bone, and the facial vein. So this is the part of the mandible that I was telling you to palpate, and you can feel a pulse. Now this is a vein, so you're not going to feel a pulse from that. But the facial artery runs adjacent to the facial vein, so you will feel a pulse from that. See you on the next module.